She's been treating orthopedic injuries for over 25 years, from trauma surgeries to walk-in care. In this interview, she reveals how one clinic is redefining urgent orthopedic treatment, faster, smarter, and all under one roof.
Hi, I'm here with Maria Trotta, who is the Clinical Director of Total Ortho Express. Maria, as the Clinical Director of Total Ortho Express, what is your role?
So I manage all the orthopedic practitioners here. I do all chart reviews, review all MRIs that are ordered throughout the day through Total Ortho Express. I've been a ortho PA now for 25 years, so
wow.
I go through all the plans and make sure everything has follow through and follow up.
That's great. And how long have you been with the practice?
20 years now.
Wow, that's great. And what about Total Ortho Express?
9 years. We opened up our first location 9 years ago, and now we have a total of 4.
So you have 4 locations here on Long Island. Where are the locations, and can you tell us about the hours?
We have 4 locations, Massapequa. Hours are 10 to 8 Monday through Friday, 10 to 6 Saturday, Sunday. Then we have Deer Park, Syosset, East Meadow. All those hours and locations can be found on our website.
Great, and that's totalorthosportsmed.com. Can you tell me a little bit about your background and your training in orthopedics and how that plays into your role with Total Ortho Express?
Sure. So I've been a PA for 25 years, same ortho PA. I've been trained in level 1 trauma when I was at Nassau University Medical Center. I'm a sports PA. I'm in the OR with Dr. Rotolo most of the time, but I do see my own patients and I manage all the urgent cares.
So can you tell me a little bit about the differences between working in a hospital setting versus the orthopedic urgent care?
In our urgent care, we see walk-ins, we see acute injuries, and we are all based just ortho, and that's what sets us apart from a regular urgent care. According, like in the ER, you go there and you could sit there for hours to be seen, 6 hours, because they are busy with sicknesses and other illnesses. At Total Ortho Express, usually you're in and out within the hour and you have a plan when you leave.
Can you tell me what Total Ortho Express is?
We are a walk-in ortho urgent care. We only see ortho injuries.
So what do you treat here at Total Ortho Express?
We treat all orthopedic injuries, if it's acute on the field versus an exacerbation of arthritis.
What are some of the treatments that you provide here at Total Ortho Express?
Splinting, casting, injections, bracing. You say it, we do it.
And let's say you see a patient that has a more severe injury. What's the process like?
Well, we make sure that they're stable, first of all. If there has to be an ambulance that gets called to our facility, we will provide that, obviously. On the other hand, if it's something more of an urgent matter that should be going to the emergency room, we will call the emergency room prior to them going, so when they do show up, they already know their plan. It is a set plan. They don't sit there for 6 hours. We help provide them to get the quickest possible treatment.
What are the most common injuries that you see throughout the year?
So it depends on the season, right? If it's a high sports season, we'll see knee injuries, ankle injuries. Maybe when they're coming home from college, we'll see them on the weekends when they're around with their parents. Wintertime, snowstorms, we'll see slip and falls, wrist fractures, elbow fractures, hip fractures.
Can you tell me a little bit about the team approach to how it works here at Total Ortho Express?
Absolutely. So when you come in, we treat you acutely. For follow-up, we do have subspecialties with Total Orthopedics. So if you injure your wrist, we have a wrist specialist. If you injure your ankle, we have a foot and ankle specialist. Knee, hip, we have a specialist for all areas of the body.
In the throes of a soccer game and I rolled my ankle on the field and I don't want to go to the ER, what are my options?
You just walk in. We're open.
That's it?
That's it. No appointment is necessary. You don't have to go to the emergency room and you have to wait with sick people next to you or wait 6 hours. You don't have to go to a regular urgent care where will they refer you to ortho. You just come to us. We have it all.
Maria, what are some of the advantages of Total Ortho Express?
So unlike going to the emergency room where you wait there for 6 hours, get seen, and then told to follow up and call another place to get follow-up, you come to us, we see you within the hour, you leave with a plan, and you follow up with one of our Total Orthopedic subspecialists.
And that's right within Total Ortho?
Right within Total Ortho.
So I don't have to try to call this one, call that one?
No, you leave with an appointment with the specialist that you need.
What if a patient needs imaging? What do you offer at Total Ortho Express?
All 4 locations have X-ray, ultrasound, and 2 of our locations have MRI, Massapequa and Syosset.
Are either of those MRIs open?
sciasis.
Oh, that's great. Why would a patient coming in through Total Ortho Express need an x-ray?
When you come in with an injury, it's hard. We don't know if you might have injured your bone without an x-ray. So that is why we need an x-ray, even though a lot of people want an MRI, and we understand that. But insurance companies require x-rays. So we do provide the x-ray, the read, for us to then take it to the next level if necessary.
And your team provides assistance with getting these imaging studies approved?
Everything done. So we will start the approval for the MRI or CAT scan. We will then have follow-up after your MRI. We review your results and then make sure you follow up with the subspecialist on that body part.
What type of specialist does Total Orthopedics have if a Total Ortho Express patient needs follow-up?
We have spine, we have wrist, we have elbow, we have shoulder, we have hips, we have knees, and ankle. We have it all.
Why would a patient need ultrasound?
It's more for a guidance tool for us. We use it to give joint injections.
Can you walk me through what a patient can expect when they come to Total Ortho Express?
When you first come in, we'll examine you thoroughly, get any imaging that is necessary. We provide bracing, casting if necessary, injections. We'll order MRIs if necessary, again, physical therapy, occupational therapy. The main thing is that you leave with a plan. You leave with a plan of the next step to get you to where you were. We treat your pain. We have follow-up with one of our subspecialists from Total Ortho, and there's never guessing on what your next step is.
What is the craziest injury that you've seen at Total Ortho Express?
I would say it's an open ankle fracture. When patient came in, his bone was sticking out of the inside part of his ankle.
And what did you do?
Quickly, we washed it out, reduced it, splinted him, and sent him straight to the emergency room.
And you guys called ahead?
We called ahead, so they were already waiting for him when he hit the door.
Wow. Did he wind up coming back to Total Ortho to follow up?
He did. He needed surgery by one of our orthopedics, and then he followed up.
What is one thing that you would like the community here to know about Total Ortho Express?
We have it all here. You know, we're a one-stop shop. We treat every orthopedic injury. We have all imaging if needed, and we care.
That's the most important thing, really, is that you do care. Is there an injury that you see over and over again that just kills you to keep seeing?
I know I'll probably got some enemies with this, but trampolines.
Really? It's the trampolines?
The trampolines, the injuries that you see with trampolines from little children to adults is significant.
Wow.
And some require surgery.
Oh my gosh.
You think twice.
Well, at least we have Total Ortho Express, and they can come see us here. Do I need an appointment to come to Total Ortho Express?
Never. It's a walk-in.
What is the youngest patient you'll see at Total Ortho Express?
10.
And what is the oldest?
No limit.
You'll see everybody.
Everybody, from 10 up.